Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education.
And Janice Maddock with the same company.
We're here in Indianapolis and we're getting ready to present at the EFPS 2018 Summit. And this is really about helping you specialize and create greater outcomes, have a greater impact with your clients, and generate the income that's deserved of a specialist.
And with that, some of the areas that we would help you specialize in, or we specialize in, and that we talk about today, and oftentimes when we're at these conferences, is working with those clients who are post-rehab, those clients who come in with actually incomplete rehab syndromes, meaning they had some kind of minor injury and they never really had to seek or were unable to seek any type of therapy for it, but yet they know that you as a fitness professional work with exercise, so they come to you for help seeking, how do I get better from this minor ankle sprain or strain that I had? Also, working with those clients who struggle with osteoarthritic changes. Maybe they've been told that they have osteoarthritis of their spine, their knee, their hip, and they don't know what to do about it, and they've been told that this is just how they have to live. Well, that's an area that we really help clients excel and feel better in their bodies. Also, another area that was really started to boom within our own practice is working with the youth athlete. Because so many of them are working so much harder, their training schedules are so intense, and they're at these young ages where they're not getting enough sleep, proper nutrition, and they're getting these already reoccurring injuries that are really bringing them out of the game. My godson was out of the game for 9 months while he had to rehab, and his rehab ended up coming through us because the other options were just surgery.
Yeah, Janice's nephew Addison initially had a knee injury, and they diagnosed it as Osgood-Schlatter's, and they said it's because he's growing, but he only had it on one side. So when you start to hear things like Osgood-Schlatter's, which is just a strain of where the patellar ligament is pulling on the condyle of the tibia, it's like, why does this athlete only have it on one side? So he had painful knee, and he just kind of worked through it. He did a little bit of rehab, and then he just kind of worked through it. Well, about 6 months later, he developed what's known as a Haglund's deformity on his ankle. That actually took him completely out of sports because it was so painful. He couldn't wear shoes, and he's again a Wisconsin kid that in the middle of winter, it's real cold up there. He was unable to wear shoes with backs. He was wearing sandals all winter long because he couldn't have anything rubbing up against his calcaneus, or his Achilles tendon, the attachment where the deformity was growing. And he had been through therapy, and then saw an orthopedic surgeon who recommended that they're going to detach the Achilles tendon and then scrape down the bone and reattach the calcaneus. And I told him, if you have that done, you'll likely never ever achieve your highest potential. And again, it wasn't to discourage him, it's just the reality that you will not be the same after a surgery like that. So his mother drove him down to Chicago one time a month, so I literally saw him 6 times between January and June, and he just got back to playing, so we put him on a return to sport program, and I just checked in with his mother, and she said he just scored his first goal. She said she can notice a difference in him with all the other athletes that are on the field. He's stronger, his form is better. She says he has no pain anywhere. He used to suffer from, experience chronic low back issues or hip issues, has none of that now because he took the time, worked through the program, and again, it's the same things that you can do as a health and fitness specialist when you understand how to properly assess, how to use corrective exercise in a strategic manner to help these individuals develop more optimal and efficient habits, and then teach them how to integrate these concepts into the fundamental movement patterns that our athletes or our senior population need to do to get back, to confidently get back and competently get back and safely get back to the activities they need to, want to, and ultimately love to do.
So Addison is just one story of a client who came to us who was pretty much for a 15-year-old kid, his wit's end, and so was his mom, because she was really struggling because he had now gone pretty much 3 years in pain and told to use pain as his guide, that he was going to just have to live with this pain he was having, and to ice after every single practice and ice after every single game. He was 15 years old. I don't know, we're not parents, but I know that myself at my age, I don't want to have to live with pain that I have to ice after every single time I do an activity. That's just not a life that we should have to expect to live, especially when you're 15 years old. So our job as educators and our job as practitioners is to really educate and explain why somebody is having the issues that they're experiencing, how can we best serve them, and how do we help them reach the goals that they have told us that are theirs to get to. and to address it in a way that makes sense. I think that's one of the biggest things one of my newer clients keeps saying to me. She's like, wow, that just makes sense. What you're saying just makes sense, and that's different. And she was a client who came after going through physical therapy for low back pain, and it was only getting worse. Now, I'm not saying physical therapy is bad, but they were not obviously addressing the issues that she was having, because within 2 weeks of just making the small changes to how she sat, how she was exercising, she was able to sleep several nights in a row without pain, which is something she hadn't done in months. So when you talk about rest, sleep is obviously one of the most important things we can do for rest. And so her being able to rest again allowed us to able to progress her very quickly for somebody who had been struggling for so long with this kind of discomfort. So, but you have to be able to identify what the problem is that they're experiencing. You need to be able to see that in your assessments so you know how to address it. But most importantly, you need to explain and educate it to your client what's happening and how they can make those changes.
So one of the things we do here on Facebook Live and on our website, in our monthly, or I should say weekly blog, is to share with you the integrative movement system, the proprietary system we take all our clients and patients through, regardless of what they're coming to us with and where they're ultimately trying to get to. So that way you have a strategic approach of how to assess, how to use corrective exercise, and how to integrate these concepts into the fundamental movement patterns that, as I mentioned, all our clients need to do to successfully and safely accomplish their health and fitness goals. And that's what we teach as part of our intensive certification courses, our Integrative Corrective Exercise Instructor Program, as well as the Integrative Movement Specialist Certification Program.
Hey, I just want to give a quick hi to Nancy, we saw you on there, and Peter and Roy, and hey, Carrie, thanks for checking in with us this morning. So, listen, this weekend we're going to be talking to fitness professionals, we're going to be talking to medical doctors as well, about how do you add a component of medical fitness to maybe what you're already doing in your facilities, because we're actually going to be talking to gym owners today. How do you add this medical type fitness to the organizations that you already have? We're going to talk to some group instructors later today as well, who specialize more in small group training with older population. And we're going to talk to them about, you need to have a specialist in your facility, because group training is awesome. It creates that community. Your clients love that kind of stuff. However, from time to time, you're going to have to take somebody aside who's just not progressing with the rest of the group and help them progress with the rest of the group by taking them aside separately, assessing them, finding what's driving the issue that they're not getting that success that everybody else is around them, and help them progress to where they want to be. And also we're going to talk to doctors, because doctors are in a key position right now with the change in healthcare, with the change in the insurance industry, to be the voice for their patients and clients, to help them find the right person to help them change, especially the orthopedic physicians who, a lot of them, I just had a patient say to me this week, my doctor said surgery is an option, but it's a last option. She was actually talking to an orthopedic surgeon, and he said, it's an option for you, but it's not what I recommend at this time. He recommended physical therapy, and her answer was, well, I already did that and it didn't work for me. I'm just gonna keep doing what I'm doing with Janice, which she told me she was gonna say to him anyways. But the reality is he could have, if he had a specialist in his office, he could have said, okay, I know you don't want to go to physical therapy, but I want you, if you're a person who loves to work out, I want you to go see my medical fitness specialist here in my office. So helping doctors realize, one, a cash income for them, a cash stream, because a lot of them are suffering, not having the lifestyle that they've become accustomed to, which is not a bad thing. But they want to still care about their patients and provide their patients with the best options available. So helping them understand the power of offering this type of service within their space that they have and within their practice, to create that community, create those customers and patients and clients who want to come back and talk about their practice. So we're gonna have a super fun weekend this weekend, just talking and sharing this information and the power of it with so many people who have the potential to bring this to their patients and clients.
So with that, we have to get down to the conference. It's about to start here in about 10 minutes. So I want to thank you for what you do for your clients, and hopefully through this information that we're sharing with you both on Facebook Live as well as through our weekly blog. And you'll want to join us for one of our intensive certifications, so that way you can get to the next level and really become that specialist, that go-to specialist in your area, so you have greater outcomes, greater impact in your communities, as well as generate the income deserved of a specialist. So thank you again for allowing us to share this information with you, and for all you do for your clients and for our profession. We'll see you. We'll bring you updates throughout the weekend as well. Make it a great day, and I'll be back Monday also sharing more strategies with you about working with clients that have incomplete rehab syndrome, and specifically around the ankle and foot complex.
So before we sign off, if you would like to learn more about our certifications and how you can get more information on those and become that specialist, visit our website at www.iihfe.com and click on certifications. We'll see you soon.
Take care. Bye-bye.